Good afternoon, everyone. I would like now to switch your attention to advanced HIV disease. I'm going to share with you some of the sonographic findings that we found in Malawi at the Lighthouse Clinic from Kaposi Sarcoma patients. So the purpose of the evaluation is just to bring upon some of the thinking ideas to all providers that are working in HIV clinics, that there are findings that may mimic disseminated TB on ultrasound scan. So as you might be aware, the FASH is widely used and has been widely adopted to aid in the diagnosis of disseminated TB in the patients that are presenting with advanced HIV disease. So for the picture that is projected on your right-hand side, is just showing the windows that we look for the various findings, for example, pericardial effusion, pro-effusions, lymphadenopathy, as well as lesions in the solid organs. So Kaposi Sarcoma is one of the frequent opportunistic infections in HIV patients in Africa, specifically in Malawi. And when it comes to systemic Kaposi Sarcoma, it can also, the patients can also present with effusions and enlarged lymph nodes, as well as infiltrations in the lungs and the spleen, as well as the liver. And these are often mistaken for signs of TB. So as I said, we did an observational study at Lighthouse Clinic in the period of 2021 to 2022. The clinic has successfully established a KS treatment program using paclitaxel, which was newly adopted in the recent guidelines. We also have a poster that describes the same, and you're most welcome to visit the poster 133 on our treatment program. So this evaluation was aimed at characterizing and quantifying the prevalence of the sonographic findings in 30 Malawian patients with newly diagnosed Kaposi Sarcoma that were referred from the oncology ward in the central hospital where Lighthouse is located, and were due for paclitaxel chemotherapy. So some of the results that we uncovered, we found out that lymphadenopathy was very common, and in 20 out of the 30 patients, inguinal lymphadenopathy was particularly pathognomonic of Kaposi Sarcoma. In the 20 patients, 3 of them had additional abdominal lymph nodes, and effusions were also observed in 8 patients out of the 30. These lymph nodes were similar to the ones that we see in disseminated TB. We also noted some focal lesions in the spleen, which were mostly hyperechoic. I had presented in the first slide, maybe if I may go back, there's that slide, the picture on the right, the ultrasound picture. So you can tell that these are hypoechoic lesions that are most common in TB. But when it comes to Kaposi Sarcoma, you could see that the lesions were mostly hyperechoic. And also, there was a sponge-like pattern that was observed in Kaposi Sarcoma patients. As you can see also on the picture down there on your right side. So whilst the hyperechoic lesions may not pose a diagnostic problem for you to differentiate with TB, but the sponge-like pattern can often be mistaken for the microabscesses that we see in TB. And therefore, patients can mistakenly be initiated on TB treatment when it's basically Kaposi Sarcoma that needs to go on chemotherapy, paclitaxel to be specific. So in conclusion, these findings underline the importance of a thorough physical examinations on the skin as well as the mucosal membranes, just to assess any lesions so that it supports the findings on the ultrasound scan. So this was done in Lilongwe. So in my very last closing sentences, let me acknowledge the study participants that took part in this evaluation. Our clinical advisor, Dr. Tom Heller, who has written a lot also in this field of FASH, the providers at Lighthouse, CDC Malawi, as well as the Ministry of Health Malawi. Thank you.